Did you know that 1 in 3 people will be diagnosed with cancer during their lifetime? The heartbreaking truth is that many cancer cases are detected too late because people fail to notice the early warning signs. According to experts, detecting cancer at stage 1 significantly increases survival chances, while late-stage diagnoses can lower this to less than 20%. Early detection can be challenging, but knowing the signs can dramatically improve your chances of saving your life or that of your loved ones. In this video, we'll introduce you to the early warning signs of cancer, some of which you may have already experienced or noticed, though I sincerely hope that's not the case. Without further ado, let's explore these signs. Number 1. Persistent heartburn. Heartburn is something many people experience and often attribute to a heavy meal or spicy foods. However, when it persists for weeks or months, it could signal something more serious, such as esophageal cancer. Here's how it works. Chronic acid reflux can gradually damage the lining of the esophagus, leading to a condition called Barrett's esophagus, which increases the risk of cancer. While occasional heartburn is common, long-lasting reflux that doesn't improve with medication or dietary changes should never be ignored. If you notice difficulty swallowing or unexplained weight loss, along with persistent heartburn, it's time to consult a doctor. Number 2. Unexplained night sweats. Occasionally, waking up drenched in sweat happens to everyone and is usually harmless. However, when night sweats persist over time and force you to change your sheets or clothes frequently, it could signal something more alarming. One possible cause is lymphoma, a type of cancer affecting the lymphatic system. These night sweats often don't appear in isolation. They are typically accompanied by symptoms such as fever, unexplained weight loss, and extreme fatigue. This occurs as your immune system responds to cancerous cells, disrupting your internal thermostat and triggering intense sweating episodes. The key difference between normal night sweats and those requiring concern is their frequency and severity. If you wake up soaked and also experience fever or weight loss, take it seriously and consult your doctor. Number 3. Skin rash. Most of us dismiss rashes as annoying but harmless, often attributing them to something we ate, wore, or just a minor irritation. However, did you know that certain rashes can point to something as serious as leukemia? One specific type to watch for is called petechiae, small red or purple spots that appear on your skin. What sets them apart is that they don't fade or lighten when pressed. These spots could be a sign of underlying blood-related issues, such as leukemia, especially if they are accompanied by easy bruising or unexplained bleeding. If you notice such spots, particularly alongside other symptoms like frequent bruising, don't ignore them. It's crucial to seek medical advice promptly. Number 4. Bone pain. Let's talk about something many people tend to overlook: persistent bone pain. Occasional aches might not seem like a big deal, but this is different. If you feel a deep, persistent pain in your bones that doesn't improve over time and instead worsens, it could be a warning sign. Bone pain that doesn't respond to common painkillers and feels localized within the bone itself, not in the surrounding muscles or joints, should never be ignored. This type of pain could indicate cancer that has spread to the bones, or even a primary bone cancer, such as osteosarcoma. Don't dismiss this as just an effect of aging. It's your body sending signals that something may be wrong. If you experience such symptoms, seek medical attention promptly. Number 5. New and unexplained pain. It's normal to experience occasional aches and pains, but when a persistent, unexplained pain develops that doesn't respond to usual treatments, it's time to be concerned. Pain is your body's way of signaling that something might be wrong. For instance, abdominal pain could potentially indicate cancers like bladder, prostate, or penile cancer in men. In women, unusual pain or tenderness in the breasts might be an early sign of breast cancer. The key to distinguishing normal pain from something more serious is its persistence and resistance to common remedies or painkillers. If the pain doesn't subside and lingers, don't ignore it. Consult a doctor to investigate further. Number 6. Persistent fever. Fever usually signals that your body is fighting off an infection. However, when a fever persists without any clear reason or keeps coming back even after recovery, It could be an early warning sign of blood cancers, such as leukemia or lymphoma. You might wonder how to tell if a fever is normal or something more serious. These concerning fevers are often cyclical, they come and go, and do not respond to standard treatments. Over time, they may even worsen. Additionally, they often appear alongside other symptoms like night sweats, unexplained weight loss, and extreme fatigue. These signs indicate that your body may be facing more than just a regular infection. In blood cancers, the immune system becomes compromised, and the ongoing battle against cancerous and infected cells causes such fevers to persist. If you experience a fever lasting more than a week or longer, it's critical to consult a doctor, even if the underlying cause turns out to be unrelated to cancer. Early detection could save your life. Curious to know which foods are the deadliest after the age of 50? Don't miss this video, and don't forget to share your thoughts about the video in the comments and hit the subscribe button.